recognize that I've been given a tremendous opportunity here with the program. Already in the first couple months of medical school, it's been more than I could have imagined.
I personally have never heard of anything like this, and I think the opportunities that it provides to students are so unique.
We've been provided a living community and a learning community so that we are spending a huge amount of our time around other people who want to accomplish change, who are really, really motivated to become great physicians.
For us, really, it was about creating a new way to think about graduate medical education. We're teaching technical literacy. We're making sure our students are very well attuned to human-centered design thinking and leading with purpose and empathy. Those are all of the qualities that physicians will need to be incredibly successful.
I think Walter would be pleased by the intentional expansion of the Scott Scholar program into UNMC. Walter knew it was important for Nebraska to have access to high-quality medical care facilitated by a team of experts focused on research and innovation.
Walter, he was a lifelong learner, and he thought that was the pathway. He was a staunch supporter of education.
Make sure you go out and make something happen that's good for you, your community, and somewhere you're going to make a difference in the world, and I think that's absolutely fabulous.
We talked an awful lot about what it would take to recruit and retain the best and brightest here in Nebraska. You give them a high-impact program. You, of course, wrap that around with unique leadership and support services. Then you offer them a great opportunity to stay in the community. That's pretty much the magic that makes it happen.
We encourage them to start the program a month early, a summer bridge program, where we begin laying the groundwork, helping them understand leadership development, management in healthcare, understanding design thinking, experiencing the world through this global immersion program, and then ultimately applying design thinking to a community in Nebraska.
Everyone in our cohort really valued the Bridge program as a way for us to understand each other, develop ourselves as individuals before school started, and just have that camaraderie. We spent a week in Mexico really learning about the global health perspective.
We were able to go within the Mexican healthcare system that week, so we toured hospitals in the public sector.
That Monday, we went right into shadowing physicians at a clinic there and sitting in on the patient interactions.
When you actually go to different cultures that you think you have nothing in common with, you realize how much similarity there is, how much we are connected, and how much we have in common.
Just seeing that even before they start medical school will give them a greater appreciation for how healthcare provision differs across countries.
It got me started thinking about how we could learn from other healthcare systems and how we could incorporate that into our healthcare system.
It takes you to, I think, the discussion of what's the art and what's the science of medicine. Well, this gets to the art. That people relationship, that understanding, that sensitivity. And I think the biggest lesson they could bring with them is to humanize that experience.
Health design thinking is absolutely core to what it means to be a Scott Scholar. It's something that we start talking about really from the first program that we have.
What design thinking allows these students to do is to learn how to think about problems in a way that puts the patient first. If you know how to solve problems, not only will you be a better healthcare provider, but also you will have the opportunity to add critical information that's going to benefit literally thousands or millions of people.
Somewhere where I've used health design thinking is through the small business that I've created with another Scott Scholar, Ryan Chapman. It's called White Coats, Right Code.
It's basically a crash course in coding in the way that med students would typically use it for research.
So from day one of this program, I started developing, a marketable skill that I'll be able to use and be able to really build on through all 4 years of medical school and hopefully my career.
The program has given us every tool possible to bring our ideas into the real world.
The pass-fail of step one is it's harder now to distinguish which students are doing well compared to others. Having that extra component of something you can add to your portfolio does give you somewhat of an edge, especially having skills in leadership and critical thinking are both areas that will be highly valued by a lot of specialties. This is going to be really transformational for these students, and hopefully it will be transformational for us as an organization and as a state.
Really, the number one thing that this program has offered to me is a group of friends that challenges me to be the best version of myself possible.
They're going to look back and go, this was one of the greatest experiences of my life, was to be able to live in close proximity with these folks, work on projects together, and solve problems.
It's been amazing. It's been more than what I expected, and this has allowed each of us as individual students to kind of be an agent for change.
I did not find anything like the Scott Scholars Program anywhere in the country, and I still look around and I don't think you will find anything like this.
With Walter Scott having his quote, "to do great things," that just inspires me to dream big and try to achieve all of the goals that I have set for myself.
The real pride in this program will not be achieved during the time of the educational journey, but it'll be really measured long term.
We want these students to be not just the best doctors they can be, but the best leaders that they can be.
We hope that Nebraska is known not just for producing and training excellent physicians, but for training excellent leaders that will go on and change our communities in a positive way, but also the world.